Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about something that affects millions of people around the world. It's called chronic lumbar pain. That's low back pain that just doesn't go away. And it can turn even simple daily tasks into a struggle. But there's good news. There are new effective treatments, and we're going to talk about them today. Joining us on Doctor is someone who's on the front lines of this innovative pain management for chronic lumbar pain. Please welcome Dr. Bryn Henderson, a board-certified physician and expert in regenerative medicine. Dr. Henderson brings a wealth of knowledge about how we can not only manage chronic lumbar pain, but actually heal the body using cutting-edge techniques. Dr. Henderson, thank you for being here.
Oh, thank you.
So let's talk about chronic lumbar pain or low back pain.
Chronic lumbar pain is a long-standing pain in the low back, usually sticking around for 12 weeks or more. It can be constant or intermittent. It can come and go. For many people, it affects their work, their sleep, and their ability to enjoy life. It's one of the most common reasons people see their doctor.
Well, what causes it?
The causes vary, but some people have degenerative disc disease, which means the discs in the spine are wearing down over time. Others have arthritis in the joints of the back. That's the inflammation between the bones. Or others have strained muscles or ligaments. Sometimes a herniated disc between the bones can press on a nerve. But in many cases, we don't find a specific cause. It's just chronic, ongoing pain from years of wear and tear.
Is it true that our genes can affect whether we get back pain? I've heard that men who are tall, like over 6'5", get back pain more than, say, short people.
There's no question. No question. Absolutely impacts. Research shows that back pain can run in families, and certain genes affect how your body handles inflammation and pain. So if your parents had chronic back problems, it's pretty good likelihood you might be likely to develop it too. It's not destiny, but it increases your risk.
All right, let's talk about the factors from early life that could play a role.
Well, there are things like poor nutrition, especially during pregnancy, low birth weight of the fetus, or spinal development problems in the womb that affect the health of your spine even as an adult. Even how you were delivered, C-section versus vaginal birth, might have subtle effects on spinal alignment or nerve health later on.
All right, so when someone comes to you with chronic back pain, what's the first step you do?
First thing I do is listen. I want to know that history. We ask them, what makes it better? What makes it worse? How does it affect their life? You know, Medicare has a mnemonic, OPQRST. O is for onset. P is palliative, what makes it better or worse. Q is quality, is it sharp, is it dull? R is radiation or region of the body affected. S is severity, usually on a number of 0 to 10. And last is temporal, timing. Is it always in the morning? Is it always at night? Whatever it is.
Okay.
Then we check for any serious signs like nerve problems or past trauma. And we usually start with the conservative therapies like physical therapy and anti-inflammatory medicaments. And I'd like to give you another mnemonic. You just got one, here comes another. And it's given as a practical tool that you can take home. And it's back care, B-A-C-K, care, C-A-R-E.
All right, B stands for?
Build your core strength. Do exercises that support the spine. Pilates, walking, yoga, all are good.
A.
Avoid prolonged sitting. Stand up and stretch every 30, 40 minutes.
C.
Is the correct posture. Keep a neutral spine when sitting, standing, and lifting.
K.
K is to keep a healthy weight. So don't get fat, reduce your excess weight, and ease the pressure on that lumbar spine. C is cold or heat therapy. Cold reduces inflammation, and heat soothes muscle tightness.
A
is to adhere to your treatment plan. Stick to prescribed meds, physical therapy, or injections.
R
Is relax and manage stress. Boy, is that a big one. Stress can amplify anything, especially pain. Use the breathing exercises for mindfulness.
E
Stands for ergonomic. Adjust your workspace, your chair, and even your mattress and bed to support your back.
All right, so somebody comes in, they've got back pain, it's chronic over 12 weeks, and the first thing I would do is maybe start them on ibuprofen or Tylenol or and say, what if that doesn't work?
Well, then you back up and take it from the top. Back pain can be due to a lot of things, right?
Right.
You can easily pick up a UA, a urinalysis, and see if they're hydrated and if they have no blood in their urine and there's no infection, then you know it's not probably any kidney and they don't have any frequency or urinary symptoms. But the other thing about backing up is you can have them lie down and do an exam on that low back, see if there's impairment, just like chiropractic care, osteopathic care. There's all kinds of evaluations you can do on somebody's spine. And if you do it properly, you can usually pick up the location. The key is the location. Is this an L5S1 area? What's going on here?
Yeah. So what if those treatments don't work and patients are going, I'm fed up, I'm tired of your ibuprofen, doctor, I'm tired of your Tylenol. You won't give me anything stronger unless I go to pain management and have a contract. I don't want to be on pain management. A lot of people actually don't want to be on hardcore pain management medicine. There are some that do, but more than not say there has to be something else to help me.
I'm probably one of those guys. We use regenerative medicine. Therefore, what we do is draw that blood and spin it down and end up with some platelet-rich plasma. And we add peptides to it to begin with and target the areas that were positive in the exam to reduce that inflammation. See, inflammation is going to precede pain. So if you find out where the inflammation is, you can get ahead of that pain.
Okay, now, so how they say they do that? They come to you, they have the plasma-rich protein, you inject it where?
In the areas of injury, if it's injury. If it's not, you inject the areas of inflammation.
But you're not going into their bone with the PRP.
Not in the bone, you go into the surrounding tissues. You're bathing the neurovascular complex.
Okay, give me the percentage of how many people. Is it 80-20 that have success?
Easily 80%.
Wow. Okay.
Yeah. You can add hyaluronic acid to that injection and have a lubricant back there too. We're not tied to any one injection. We have 7 injections for a back.
But what about these people who have herniated discs? I mean, just the word herniated disc sounds, I'm sure people listening don't even know. Can you explain a herniated disc?
Yeah, a disc is a washer. It's between the two bones. So you have vertebral bodies we call bones, and then there's a washer in between. That's a disc. And so those discs, as we age, get dry and get brittle, and they don't move good. Or you have some damage. So let's say you picked something up that was too heavy, and you strained your low back.
Oh,
yeah. Well,
it doesn't sound good.
No, it hurts. It hurts a lot, and it can radiate, and that's one of the keys. Is to figure out the radiation.
All right, so you're saying, again, we can use PRP, we can use exosomes, we can use hyaluronic acid, we can use stem cells. We've got all these new things that people have never heard of. It is cutting edge medicine and it's going that way. But give us some little simple, proper changes that they could do on a daily basis.
Oh, that's a good idea, because the simple changes like proper ergonomics, just sitting correctly, getting up and doing stretches so you're not on your tush all day long, is a good idea. Staying active because you not only don't want clots, but you don't want consistent pressure on any one part of the support structure of your body. It helps you deal with the stress and the pain at the same time.
And of course, your lovely acupuncture that you love so much, your 5,000-year history of Chinese medicine, how does that help?
Well, it starts off by relieving the muscle tension, and the trigger points are on the meridians. So this is not new. You can find them. In fact, you have trigger points in your arm and your neck, all kinds of places. And if we restore the balance, that's what acupuncture does. It helps us restore the balance in our bodies, and that reduces pain.
What can happen if chronic lumbar pain is left untreated? Oh, I see those patients all the time. Oh, what a question.
Over time, I'll jump in here. Over time, it can lead to some pretty serious problems. Besides the muscle weakness and nerve damage, you end up with depression, sleep issues, infertility, erection issues. People might stop working or lose the ability to enjoy everyday activities. That's why early treatment is a big deal. And a full body, whole person approach is so important.
All right. What should viewers take away from this conversation?
I think if you're struggling from chronic low back pain, please don't lose any hope. We can absolutely help that. We address it with some lifestyle changes. If you're overweight, we'll help you lose. If you need exercise, we'll get you fit. We can do that to reduce the pain and restore function. The key is a personalized plan, so you don't have to live with pain forever. That's ridiculous.
What about that hydrogel?
Hydrogel is excellent. It has to be done in the right person, and many times it's even covered by insurance.
Well, what we learned today is chronic lumbar pain can be a lifelong burden. Doesn't have to be. Today we learned that with the right mix of modern medicine, personalized care, and some simple lifestyle changes, there is a way forward to be pain-free. A huge thank you to Dr. Bryn Henderson for sharing his time and wisdom with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.